Dr. Clinton Boyd. Clinton is a colleague of mine in the Belfast Trust and has been a consultant pathologist since 2012, now reporting breast and thoracic pathology. He has a managerial role in the laboratory and is currently involved in the implementation of digital pathology reporting here in Belfast, so could have fitted into either half of this webinar. But today he's going to give us his version of the COVID story, entitled Fear and Coping in a Pandemic, Reflections from the Tissue Pathology Lab. Clinton.
Thanks, Morris. Can I just check what you can see, please?
Yeah, can see and hear you.
All right, great. Okay, well, as Morris says, I'm Clinton Boyd. I'm a pathologist here in Belfast Trust Lab. I'm just going to reflect on really how we were first hit by COVID-19 quite early on, how we reacted to that, and what sort of coping strategies we adopted. We made mistakes, so we'll talk about those as well, and hopefully be able to apply those to the future and maybe not make the same mistakes again. So how did we become affected? Well, like many COVID stories, this one begins with a ski trip. This is our head biomedical scientist and sort of overall general day-to-day on-the-ground lab manager who went skiing in late February. There wasn't really much mention of COVID in Northern Ireland at this point. Maybe in Connell's lab things were different, but certainly in the eyes of the general public and everyone else, we hadn't heard much about it. So we returned from skiing asymptomatic, I should stress, and came back to work. Of course, when an important person returns to work, he wants to meet up with lots of the key players and find out what's been happening in his absence and what sorts of things he needs to catch up with. So we had meetings at close quarters with senior biomedical science staff, clinical director. This picture shows our actual meeting room here in the Institute of Pathology. You know, as you can see, it's quite COVID friendly. By that I mean it provides favorable conditions for virus transmission. It's quite bijou, no windows. The door, I suppose, approximately fits in the frame, so there is a bit of rudimentary ventilation, but really coziness is prioritized over personal space in here, and that probably didn't help given what we know now. As if that wasn't bad enough, there was a party for a senior member of the trust management team that week as well, which our head BMS dutifully attended. I wasn't important enough to be invited, but knowing some of the people who were there, I would imagine, like all good parties, this one was loud and shouty, plenty of alcohol involved. So I think there were probably plenty of opportunities for transmission there as well. So now anyway, our skier has caught up fully, professionally and socially, and the weekend begins. This is the end of that weekend. So this is my WhatsApp consultant pathologist group text message from Sunday evening. I'm old enough and boring enough to have been tucked up in bed by this stage, so I didn't thankfully see any of these until the next morning. But obviously the news had got out that someone had tested COVID positive, and there was a bit of disbelief, as you can see at the time. People thought this was a joke and obviously wanted to know who it was and if it was true. Unfortunately, it was true on Monday morning. Turned out to be very real indeed. A lot of emails, text, missed calls on my phone at about 6:30 whenever I got out of bed, and that was because some of the management team had wrongly assumed that my appointment in a kind of improvement role the week before meant that I was interested in being involved in difficult problems in the lab. So they really wanted me to go in and try and steady the ship that morning. So every day there's a team huddle, mainly biomedical science staff in the lab, and I think it's fair to say the first team huddle didn't go terribly well. I had gone in with a fairly naive, in hindsight, attitude, assuming that scientific rationality would prevail at this meeting. These are scientists. They'll be good at assessing risk to themselves. But I was wrong about that. There were high emotions. There was fear. There was panic. There were tears, in fact. You know, some people actually walked out and left the building that morning. When I said COVID wasn't really an issue for the general public at this point, there was a sort of a loss of control rapidly dawning on the staff in the department, both inside and outside work. How is this going to affect my family? How is it going to affect my working patterns? Am I going to catch it at work? You know, where is my next sheet of toilet paper coming from? At this point was also a concern. But in saying that, while there was fear, panic, anxiety, many staff did go outside their comfort zone and immediately adopt informal leadership roles to sort of fill the vacuum that was caused by all the senior management team and all the senior biomedical science staff who had been in contact with our skier the week before, now being unable to come to work because they had been told to self-isolate at home. So this is kind of confirmed when we asked the staff to report the emotions they were feeling in the initial stages. We can see there was anxiety, people felt vulnerable, people felt afraid, although there were some positive emotions as well. People had a real sense of purpose, and some people were actually grateful, expressed gratitude at being able to come into work and make some kind of a difference. But in the early stage, it became apparent that constant reassurance was going to be important. It seems strange now, but in the first few days, as this took hold, full-on panic seemed possible, and we were trying to avoid that if we could, obviously, and keep the service running. I mean, there was regular communication, where staff had the opportunity to make suggestions. They were listened to. We had daily management, senior management involvement. The daily huddles went on. There were lots of emails. And we had staff coming over from the virology and microbiology labs to give a sort of an air of authority to the kind of advice that was being provided. And this did seem to have a positive effect. But despite that, only just over half of our staff felt adequately supported by senior members of staff at the beginning of the pandemic. And I suppose that's because everybody wanted more information, but at that stage it just wasn't there. Nobody knew what advice to give. Nobody knew really what the risks were. Could we catch COVID from tissue pathology specimens? We weren't really sure about any of that. So we'd been thrown in at the deep end. We had no idea how things were going to evolve. Everybody obviously was very interested in the R value in terms of viral transmission. But for the staff in the lab, medical staff, scientific staff, technical staff, R stood for something even more scary at the time, and that was redeployment. Everyone was worried they were going to be moved to somewhere well outside their comfort zone, although I think it's fair to say that staff were up for it, and there was a certain element of pride in that. But also, trepidation. We had heard rumors of pathologists in Italy and Spain being sent on to ICU to look after COVID patients. Some of us hadn't seen a patient in literally decades, and you had people going away and doing, ventilator training. People were buying pocket emergency medicine textbooks just in case, doing online blood gas interpretation courses, and really we didn't know what to expect. You can see our workload took a sudden downturn in March. Normally, we're a reasonably big lab. We normally process about 60,000 specimens a year. We are about 14,000 short at the minute. But despite that, people don't really feel any less busy. Well, about 2/5 of them do. Most people feel about the same level of busyness, and a small proportion feel more busy. But then, reality was somewhat different. Our workload had crashed. We were able to hang up white coats, get documentation checked for UCAS. We had very low bed occupancy across the province, really, and the surge never really hit. So what did we do? Well, we took all the usual smaller measures. We had, these were all staff suggestions, small things, may or may not work, but make people feel like something's being done and they're being listened to. We want a balance to be struck with these measures. You don't want too many to instill extra panic and fear in people, and you don't want to go too far with things like masks in areas like microtomy for us, for instance, where staff need to actually blow on tissue sections and they just can't wear them. So we didn't want to be too draconian. We've been forced, like everyone else, to embrace technology, and it's been brilliant to see the speed with which the IT department has improved the IT infrastructure in the trust. Multidisciplinary meetings have particularly been improved. There's less travel. You can see and show images more easily. And it's really hard to overstate the benefit of being in your own office during these things. It's also helped with teaching. We now have an all-Ireland teaching system set up, which would have been geographically impossible pre-pandemic. A variety of different approaches have been used for trainee sign-out, with multi-head microscopes really largely just ditched, and we've got more use of screens in the department. The biggest change was dividing the department into two teams. So this applied to everyone who worked in the shared space. We were uncertain about isolation requirements, and we didn't want everyone in the lab to have to isolate for 2 weeks and totally close down the service. So that obviously makes distancing easier for the half of the people who are in. It's more flexible for childcare and so on, and it's going to maybe be increasingly important as cases rise again. There are drawbacks though, with increased need for clear communication. Things can fall through the cracks between teams, and it's quite disruptive. This didn't really work well for our trainees, who were half of them were at home each day, and it really affected their case numbers. Obviously, digital pathology is going to be a massive help here. There was limited success with home microscopy, but transport of materials is very problematic. And digital pathology will really help with this, but it's not a panacea. I mean, this picture of the lab is from the 50s. Most of you would recognize this as a sort of a version of something that happens today in your own labs. And the things we do as far as tissue processing is concerned are more or less the same these days. Microtomy, the microtomes here look different, but the sections they're producing are identical. So a lot of this stuff can't be done remotely. And it sort of raises the question, should we be moving from a sort of a decentralized laboratory method to increasing centralization, where we have our floating Northern Ireland lab in the middle of Lough Neagh? That probably is out of date now because of the pandemic. It might be better for resilience if we keep a more distributed service and are able to move specimens around, but that'll need better tracking, better LIMS, and so on. So with these measures, we've changed from something frightening into something more positive. We've made ourselves more resilient. People now are largely less worried about the impact of COVID-19 on work and life. We have about a third of people more worried about lifestyle than health in the laboratory, and predictably, those are the young people. The young people here in this graph are more worried about the impact of COVID on their lifestyle than on their health. So to wrap up, we found here that communication is key. You've got to be flexible, but you need balance with your staff protective measures, and you don't want to throw the baby out with the bathwater. Don't make the mistakes we made with our trainees, for instance. Remote working will only take us so far in the histopathology lab. And on the positive side, our colleagues have pleasantly surprised us and stepped up to the job by and large. And things are better now with all the new IT innovations and so on, and the pace of change in the NHS, which, as the others have said, we're not used to. So thanks for listening, and thanks to everyone in the lab who's made the last few months go smoothly than it might otherwise have.